Chronic pain affects 1 in 5 adults in Europe and accompanies many diseases. It is essential to understand the pathway of neuronal activity leading to chronic pain, as despite progress, only 1/3 to 2/3 of patients report adequate pain relief under current treatments. The brain is a fundamental system in all human life. Our neural system is composed of neurons with axons, and they're essential for the transmission of a signal. Normally, neurons exist at resting potential, where there is a difference in potential across its membrane, which usually exists at around -70 volts. This difference arises as there is an unequal distribution of ions, particularly of Na+ and K+, and also Cl-, between the external and internal environment. The two main factors that contribute to ion concentration is the cell membrane's permeability to each species and the presence of NAK pumps. These pumps transport Na+ out of the cell, NK+ into the cell. However, there is an unequal amount of positive charge that enters the cell, as well as an unequal amount of negative charge that is held by ions like Cl- or chloride ions exiting the cell, leading to the formation of an electric gradient. When the net flow of ions into and out of the cell is constant, we are at equilibrium, and this equilibrium voltage is determined by the Goldman-Hodgkin-Katz equation. However, in the presence of a stimulus, a nerve impulse is transmitted, and this is caused by the existence of a voltage, which is a difference in charge across the membrane. Inside the membrane, there are more ions compared to what we have outside, so there's already greater osmotic pressure within the cell. This will lead to a decrease in the potassium ion concentration inside, as it is highly permeable to cross the membrane. Closer to the membrane, we also see the potassium concentration decrease while it slightly increases outside. Trying to obtain equilibrium, calcium ions will be repulsed, leading to increased calcium concentration near the inside of the membrane. This will create voltage. Voltage creates an action potential, meaning neurons can communicate via the propagation of a local charge perturbation. This is an all-or-nothing response. If the stimulus depolarizes the membrane past its threshold, then an action potential will be generated. The action potential causes a momentary reversal of the membrane potential, and this initial spike occurs at the cell membrane where it's made more permeable to Na+ ions. This causes a chain reaction where we see the increase of Na+ causes more depolarization, which in turn increases its permeability, in a process known as Na+ current activation. At a certain point, Na+ current inactivation occurs and will end the cell's permeability to Na+. There's also an increase in K+ permeability in where there's a process called delayed rectification. The two together cause repolarization. The following stage will be after hyperpolarization, where the membrane potential dips below resting potential. Repolarization causes a deactivation of the K+ and Na+ channels, allowing the membrane potential to slowly return to its resting potential. This process of passive conduction can be modeled by the following equation. When the action potential reaches the end of the axon, it needs to be transmitted to the adjacent neuron, which can be done through electrical or chemical transmission. Often these two modes occur simultaneously, but for our explanation we are going to focus on chemical transmission. Within the axon terminal, there are neurotransmitters contained in synaptic vesicles, also known as quanta. These quanta are located in microdomains, where there are also voltage-dependent Ca2+ channels. Transmission of the action potential to the terminus triggers the opening of these channels, allowing for an influx of calcium ions to enter and concentrate within the microdomains. This causes the vesicles to fuse with the cell membrane and undergo exocytosis, releasing the neurotransmitters into the synaptic cleft. These neurotransmitters diffuse according to Brownian motion and will recognize and bind to receptors on the postsynaptic membrane, causing the various ion channels to either open or close. The resulting postsynaptic current will either transmit as an excitatory or inhibitory postsynaptic potential, where the excitatory postsynaptic potential increases the likelihood of an action potential being transmitted, whereas the inhibitory postsynaptic potential has the opposite effect. Chronic pain itself is associated with abnormal excitability of the somatosensory system, which is tightly regulated by potassium channels. Opening of potassium channels repolarize or hyperpolarize the neuronal membrane, which can limit action potential and firing rate. Pain is caused by decreased potassium activity, which in turn will cause increased conduction across the axon. This will lead to disruption of the stimulation, leading to deregulated peripheral excitability, which in turn results in pathological pain states. Understanding the pathway of potassium and the impact of imbalances on action potentials leading to chronic pain will allow us to develop better treatment options for those who suffer in the future.